Welcome to this brief but essential first aid course. In the next 4 minutes, we'll provide you with key knowledge that could save a life. First aid is the immediate assistance provided to someone who is injured or ill. The goal is to preserve life, prevent further harm, and promote recovery until professional medical help arrives. Understanding basic first aid is crucial for everyone, whether you're at home, work, or in public spaces. The first step in any emergency is to assess the situation carefully. When you come across someone who is injured or unwell, you need to ensure that you are safe before approaching them. Look for potential dangers around you, such as fire, traffic, or electrical hazards. Once you're sure it's safe to proceed, approach the person calmly. Check if they are conscious by gently tapping or speaking to them. If they do not respond, it's time to call emergency services right away. Remember, always call emergency services before attempting any action unless the situation is immediately life-threatening, such as someone choking or bleeding severely. CPR is one of the most important skills you can learn. It's used when a person's heart stops beating. If someone collapses and is unresponsive, here's what you should do. 1. Call for help. Dial emergency services immediately. If you're not alone, have someone else do it. 2. Chest compressions. Kneel beside the person and place your hands, one on top of the other, in the center of their chest. Use your body weight to press down firmly. Aim for 30 compressions, pushing at least 2 inches deep and at a rate of 100 to 120 compressions per minute. 3. Rescue breaths, if trained. After 30 compressions, tilt the person's head back, pinch their nose, and give 2 breaths. Make sure their chest rises with each breath. Continue the cycle of 30 compressions and 2 breaths until emergency help arrives or the person starts breathing. Bleeding is one of the most common injuries, and it can be life-threatening if not controlled. Here's how to handle bleeding when up. Apply pressure. Use a clean cloth or bandage and press it directly onto the wound. The pressure will help stop the bleeding. 2. Elevate. If possible, raise the injured limb above the level of the heart. This reduces blood flow to the area, helping control the bleeding. 3. Use a tourniquet, if necessary. If the bleeding is severe and doesn't stop with direct pressure, apply a tourniquet just above the wound, if you have one available. Tighten it until the bleeding stops. Tourniquets should only be used in extreme cases as they can cause damage if used improperly. Never remove the cloth or bandage once applied. If it becomes soaked with blood, apply another layer on top without removing the initial dressing. Choking can occur when someone's airway is blocked, usually by food. If a person is coughing or wheezing, they might be able to clear the blockage themselves. However, if they can't breathe or speak, follow these steps. 1. Ask them to cough. Encourage the person to cough if they can. 2. Back blows. If the person can't clear the obstruction, stand behind them, lean them forward slightly, and give 5 sharp back blows between their shoulder blades. 3. Abdominal thrusts, Heimlich maneuver. If back blows don't work, stand behind the person, make a fist, and place it just above their navel. Grasp your fist with your other hand and give quick inward and upward thrusts. Continue this until the blockage is expelled or emergency help arrives. Burns can be caused by heat, chemicals, or electricity. It's important to know the proper way to treat them. 1. Cool the burn. Run cold water over the burn for at least 10 minutes. If water isn't available, use any clean, cool cloth. 2. Cover the burn. After cooling, cover the burn with a clean, non-stick bandage or cloth. Don't apply creams, ice, or ointments as they can worsen the injury. 3. Seek medical attention. For severe burns, or if the burn covers a large area, always call emergency services. Don't attempt to remove clothing stuck to the burn. Then we can conclude, first aid is a crucial skill that everyone should learn. These basic steps can make all the difference in saving a life. In summary, Always assess the situation first. Perform CPR when needed. Control bleeding by applying pressure and elevating the wound. Use the Heimlich maneuver for choking. Treat burns with cold water and cover them properly. Please subscribe our channel, and we have another blogging site for all healthcare solution and information, and you can search with healthcaredigitalibrary.blogspot.com. Taking the time to learn and practice these essential skills can help you be prepared for an emergency. Remember, calmness and confidence are your best tools in an emergency.